BBC Radio York. I was working it out. I think I've probably worked for the BBC for the past 27 years, off and on. Normally, most employers will give you a clock for putting in those hours, but I'm not complaining. I think during those 27 years, I must have done, I don't know how many features on health and healthy diet and exercise to reduce the possibility of stroke or heart attack. And guess what I'm doing now? Yes, we're talking about getting more exercise and a healthy diet, because it's still a biggie when it comes to... I'm assuming Dr. Shaun O'Connell is here from the Vale of York Clinical Commissioning Group. I'm assuming men particularly, it's still the biggest killer, is it?
Yep, it's certainly still one of the biggest killers. Cancer and dementia are up there, but heart disease, circulatory disease is still one of the biggest killers. Jules, you're right, we're still banging that drum.
Still banging on about it. So how is the message not getting through? Or are people just thinking, no, it won't happen to me?
Yeah, there's a lot of denial out there, actually. There's people we've been chatting to this afternoon who've probably got raised blood pressure but think they're going to be okay with it. And they just don't want to admit the fact that's putting their risk of heart attacks and strokes up. They think they're going to live forever without problems, whereas actually that's costing them and the NHS a lot of money.
Well, as we know, and the NHS ain't got a lot of money. So, all right, if your blood pressure is raised at the moment, is that down to lack of exercise? Is that down to a poor diet? And can you turn it round quite quickly?
Yeah, you certainly can turn it round. Maybe not, straight away, depending on where you're at. And some of it is genetic. There's certainly some predisposition within families. So if your parents had high blood pressure, then you've got a greater risk of it. If you're a smoker, then stopping smoking will certainly help to lower your blood pressure. And taking up more exercise and losing weight, those same olds, will really help to lower blood pressure. But ultimately, if you're not managing to get it down by doing those things, and they're not things that you can do easily, quickly, then I would recommend taking some medication. You can always rein back on the medication as you get healthier and as those treatments are less necessary. But for now, take the medication. Don't let that stop you adopting the healthy lifestyle, but at least you know that you're reducing your risk from pretty much the word go.
Okay, Shaun. Well, as we both acknowledged, we've been banging the drum about this. Eat less, move around a bit more, which is basically the message. So is it a hardcore of people, or is it just basically across the board of people who are just, again, thinking, well, as you said, in denial? And how do we encourage them?
Well, I think it's across the board, I think there's a lot of people who don't realise the risk that they're at, and one of the things that we're trying to do is encourage people to look at their risks. On our new website, Vale of York healthyhearts.co.uk, you can look at your heart age. Go under what is CVD, cardiovascular disease. You can see what your heart age is, and that will tell you whether you're at increased risk of having heart attacks and strokes in the future.
So your heart age cannot necessarily be, or doesn't have to be the same age as you are?
No, that's right. And I must admit, I was a bit shocked when I put my own stats in earlier today and found that my heart age is a little bit over my own age, and that's because I'm a bit tubby and my cholesterol is a bit higher than it should be. So if I could address both those things, I might have a heart age that's the same as my actual age.
Okay. Well, that's it. I mean, in modern living, is it a goal that we can... you're a doctor, for heaven's sake. So here we are. What is wrong with us that we can't attain these goals? Are they manageable?
I think they are. It's all about your commitment to whether you want to live a healthier life and whether you want to reduce the burden to yourself and to everybody else by not using NHS resources for things that you can prevent. You just have to make that commitment to yourself. I don't smoke. Despite being a doctor, I'll be honest, I don't think I drink excessively, honestly. and I do undertake quite a bit of exercise, but food is very readily available for us in our society, isn't it? So we all consume a bit more, and it only takes a little bit more every day for many, many years, and you start to put a few pounds on. But actually, if you start actually being a bit strict with yourself, you can also lose it reasonably quickly too.
Diets, well, I don't know. I mean, I've had this debate with various people. I'm not a big believer in diets. I think it's management rather than a diet.
Yeah, sure. It's not dieting. I think we should get rid of that word because it's a change of attitude to food and eating in general. Diets are fads, aren't they, by definition? And we don't want fads. We want permanent lifestyle changes. So just think before you consume more calories than you really need to. Don't eat food quickly. Try not to eat food in front front of the TV because that distracts you, and you don't appreciate that fullness quite so readily. So you eat more than you need to.
That's my pitfall. I think I eat too much and don't stop when because I'm enjoying myself.
Yeah. Well, go for the healthy plate. You know, with a quarter of the plate for protein, a quarter of the plate for carbohydrate, and the rest of it is vegetables.
And all this advice is all out there, isn't it?
It's all out there, and it's going to be on our website, Vale of York, healthyhearts.co.uk. You can get tons of information there. We're particularly looking to identify people who've got high cholesterols, particularly cholesterol greater than 5. Many of them may be on a statin already, but if they're not on atorvastatin and their cholesterol's above 5, then we'd like them to switch to atorvastatin. We think that's a more powerful, cost-effective statin for them to be on.
And I mean, is that is that a lifestyle, or is that something that you can take the statins for forever? I mean, is it I don't know.
Yeah, we believe it's safe to take statins forever. There are relatively few side effects. There's lots of scare stories about statins, and they certainly don't suit all patients. But the vast majority of patients do absolutely fine with their statins. And once they've got over the hump of just accepting they're going to try them, they don't even notice they're on them.
And is that genetic as well, or is it just a case of too many pastries?
Again, it's both. Some of it is genes. There's a lot of genes that are involved in cholesterol management within the body. Some patients, a small cohort, have very high cholesterols, and that's a strong family history. But most of us, it's diet, it's activity related.
Okay, right. Well, the jeopardy now. I've got an arm here that's...
Okay.
Well, I don't have to roll my sleeve up because I'm wearing short sleeves. So you're going to check my blood pressure. Now, I would say that some folk would say this is a high-pressure job. I was saying to Adam earlier, I think I've reached an age now where I'm sort of managing work pressure these days.
Okay, just rest your arm on the bench.
Right, so it's one of these electrical jobbies then, so it's going to make a noise, hopefully. Oh, not much of a noise.
Turn your arm over. There we go.
Oh, yeah, there we go. I thought it would make a noise. This is where it squeezes your arm. Not till it hurts, but it just squeezes your arm. And, that's getting quite tight there now.
Because we normally say to you, be quiet whilst we're doing your blood pressure, because talking actually puts your blood pressure up a bit.
Oh, does it?
That would make boring radio, wouldn't it?
Yeah, well, yeah, it would make bad radio. We'd get the sack. So, dead air is not an option here. So,
Do you want me to give the result out on air?
Yeah, go and give it out on air. How are we doing?
You're 139.88. That is not too bad.
That's not too bad.
That 88 is a little higher than we would like.
Okay.
But we'll put that down to the stress of having it done live.
Okay, fine. All right.
That's good. Thank
Good.
you.
Excellent. All right. Thank you very much. All right. So, well, there you are. You see, obviously, there is something about live radio that increases your blood pressure. Because I'm sure I don't know. It's all there on the website then, so we better give us that, and then we can point people in the right direction.
Yeah, go have a look at Vale of York, healthyhearts.co.uk. Do a few blood pressure readings. You can go into your local pharmacy or at your doctor's surgery. The healthcare assistants can do your blood pressure. If you've not had a cholesterol done lately, then get that done.
Is that a home kit job for the cholesterol, or do you have to see a doctor for that?
Many pharmacists can do cholesterol, and will do it for you, but the practice can do it as well. If you haven't had one done, then you can phone the practice.
It's not a bad thing to do, is it?
I think if you're over 40, it's worth doing.
Well, yeah, that ship's long sailed. All right, so okay, fine, fair enough. Well, that's me down to the chemist for cholesterol test. And any particular group that we're looking at here, or is it across the board, age-wise?
Oh, it's across the board, but it's certainly anyone over 40 should be having checks if they've not had them done. And if you're over 45, 50, going higher, then definitely. If you've not had one done in the last couple of years, then go and get your blood pressure checked. But the other thing we're keen to get people to check is their pulses, because we're also trying to find a condition called atrial fibrillation. That's an irregular
We're talking
pulse.
about your heartbeat here, rather than the pulses that you put on your plate, which are also good.
Yeah, indeed. Now, that's your heart rate, and if your heart rate's irregular, you're at an increased risk of stroke, and we can treat that really easily.
So that's a good warning then, isn't it?
Yeah. So just feel your heart rate with your pulse at your wrist or at your neck, and if it's not, very regular, boom, 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 boom. If it's all over the place, then again, go and see your doctor, get them to check it. Some doctors have got little gadgets on their iPhones which will check your pulse rate and will give us a really good ECG reading. Not all doctors have got them, but a lot have.
Is that an app you can get?
Well, the little gadget costs £100 to put on the back
Probably
of your
not
phone. No. But if patients want to buy them for their surgeries, I'm sure they'll be grateful.
Well, indeed, yes. Well, there we are. Doctor on the... Yes, fine. All right then, Shaun. Well, look, thanks ever so much. Thanks for coming in. So obviously I've got some work to do on the blood pressure, or maybe not. How bad was it then? Is it...
No, that's fine, Jules.
Oh, it's fine.
That's
okay.
fine. That's okay.
You got me worried now. You got me worried. All right. Thank you very much, Shaun. So, yeah, go and look at the website if you've any doubts about it. Check out your cholesterol as well. Why not?